Thank you so much for joining us today. My name's Rhiannon and I am a practice consultant with SafeLives. And Marina, can I ask you to introduce yourself?
Yeah, absolutely. Thanks for having me here today. My name's Marina and I'm the Programme Manager for the Women's Programme at GamCare.
Brilliant, thank you. So can we just start off by you telling us a bit more about GamCare itself and your role in the organisation?
Yeah, absolutely. So a little bit about GamCare. So GamCare is the leading national provider of information, advice and support for anyone affected by gambling related harms. That's either due to their own gambling or someone else's gambling. So if anyone is experiencing harms due to gambling and would like to talk through all the options of support, they can contact the National Gambling Helpline free on 0808 8020 133. We also have the live chat option, so you can go on to www.gamcare.org.uk. And if you're not able to make a phone call, you can have the option of going on our live chat, and our team are available 24 hours a day, 365 days of the year. Alongside our support on the National Gambling Helpline, we also have a range of treatment and support services that are free, confidential and non-judgmental. So we accept referrals, self-referrals or third-party referrals via the telephone or online. And more information about how you can access our support can be found on the GamCare website and clicking on Find My Local Treatment. Alongside the more traditional forms of treatment and support, we have online support available on the GamCare website. The website has a range of resources and routes of online support. So we have an online forum, and that forum is available throughout the day and overnight to connect individuals to others in similar situations. So it offers that element of peer support, and they can seek and share support on this online forum. And then we have some self-help resources as well. So it provides information. If you go onto our self-help resources on the GamCare website, it gives information on blocking software and self-exclusion. Alongside that, we have Talk Ban Stop, which is a partnership that combines practical tools with support to help stop gambling and kickstart someone's recovery journey. So it all starts with a chat really, and this offer is offered by calling the National Gambling Helpline, and we will support individuals to block themselves on gambling sites using GamBan alongside self-exclusion, so they can use GamStop that can prevent individuals from accessing accounts with all British licensed online gambling businesses. And more information on that can be found on our website. So outside the traditional forms of treatment and support, we also have started our Game Change course. What I would say is it seems to be a lot more successful and accessible to women as well. And our Game Change course is available for those who would like to work through an online course, and they'll have regular support from a GamCare therapist. And the online support allows anyone to access the course at a time that's more convenient for them, rather than feeling like they need to attend appointments. So it can be quite convenient for a lot of women who have other responsibilities. Alongside our treatment and support, we do also offer free CPD accredited training to professionals, and we deliver prevention workshops to young people. So what I would say is, if anyone is interested and wants to hear more about our free training and our free workshops to young people, you can contact our team leader, Sarah Fox, on our email address, which is programs.team@gamcare.org.uk. So a little bit about me and my role. So as I mentioned, I'm the programme manager for the Women's Programme. The programme looks to steer systemic change across policy, research and treatment to address the underrepresentation of women seeking support and accessing treatment who are impacted by gambling-related harms. So the programme is raising awareness by working with professionals across the public and third sector, and also with local communities, to highlight how gambling is linked with a range of issues affecting women and girls, and helping to better identify women in need. So ultimately what we're hoping for is there's no wrong door approach to accessing gambling support and treatment, where all professionals across the public and third sector are upskilled to recognise, identify and signpost anyone in need of support who's experiencing gambling related harms. So the programme is also gathering learning from women with lived experience, professionals and academics, and we share this across sectors and gambling support treatment and support services to improve our response to women and better meet their needs when they do access treatment and support services.
Brilliant. Thank you. It sounds like you are very busy.
Yeah, lots going on.
I wondered if you could tell us a bit more about the intersection between gambling and domestic abuse in your experience.
So yeah, absolutely. I think what we do know is there's a lot of research out there that at the moment that suggests there is a link between gambling related harms and domestic abuse. That's not to say that gambling related harms causes domestic abuse, but it can exacerbate the issue, and there seems to be higher prevalence rates. So there's a piece of research that was conducted by Hing and his colleagues in 2020 that talks about the relationship between gambling and intimate partner violence. The research talks about the clear and strong links of being a perpetrator or a victim survivor of domestic abuse, particularly intimate partner violence. And those studies have found that 20 to 49% of people with gambling problems are victims or survivors of domestic and family violence. And there seems to be a higher prevalence rate of intimate partner violence victimisation amongst women. So that goes up to something around 69%. So in the research, it talks about women describing how their male partner's preoccupation with gambling exacerbates his controlling and self-centered tendencies to the exclusion of his family's welfare. It also talks about cravings and urges to gamble and their irrational beliefs about winning, resulting in a lot of anger and frustration if they're unable to gamble. Many women describe how their partner's gambling escalated steeply over time, along with the frequency and severity of violence. And female victim survivors of intimate partner violence also talk about gambling problems used where they're experiencing gambling problems, and they use gambling as a means of physically and emotionally escaping their partner's abuse. So something that we're seeing at GamCare, particularly in the last year, and this can be found in our report on the National Gambling Helpline during lockdown. The report found that the number of helpline contacts per month reporting domestic abuse escalated considerably during COVID. So our helpline staff were increasingly concerned about the impact of domestic abuse from callers affected by someone else's gambling. So that rose from 4% in 2019-20 to 6% in 2020-21. So alongside this, some of the concerning trends that emerged regarding the number of women calling the helpline and the issues that they were facing, including the total number of safeguarding calls in which our helpline flagged domestic abuse as a concern, that grew by over 600%. So from Q4 2019 to Q3 2020. So that was in the midst of the pandemic. Of the types of callers who report domestic abuse, 80% are affected others. So they're talking about someone else's gambling and how they've been impacted by someone else's gambling. And generally, the total number of callers that female callers that are coming through our helpline is around 32%. That 32% was in 2019, so that has risen to 35% in 2020. And our latest figure shows that women make up 84% of all affected others that are calling through to the National Gambling Helpline. Alongside this, the work that we're doing on the women's programme is about gathering the voice of lived experience. And lived experience is a real cornerstone to the women's programme. And some of the women have spoken about their experience of domestic abuse. So women are talking about money being stolen from them and their children, leaving no money for food, rent and electricity. Women have been speaking about being at the mercy of abusers as to what money they get. They talk about having to take out loans to clear debt. They also talk about aggression and feeling intimidated and getting into debt due to someone else's gambling.
Well, yeah, it does sound like there's a really clear link there between those two issues. Thank you for talking that through with us. So what is GamCare's response to those issues that you're kind of seeing coming through from service users?
Yeah, so from our perspective, we want to take a whole systems approach, working across the public sector and third sector, but also working with domestic abuse services as well. And the first thing I think what we're trying to do is raise that awareness amongst professionals and local communities. There's still a reduced amount of awareness in terms of gambling related harms and how they intersect with other issues relating to domestic abuse. So we are trying to raise the awareness and understanding a bit better. And we're doing that by understanding the best platforms for communication to reach professionals and also local communities. And by understanding the platforms of communications at local levels and national levels, we're able to kind of provide resources and relevant communications for awareness raising, and also support with that targeted reach to those most marginalised in our communities. And we recognise that that's a real key priority for us. To increase accessibility for anyone that's experiencing gambling related harms. So there's that kind of awareness raising element there. Alongside that, we want to engage with local communities. Specifically, we want to work with those that we need to reach, so those that are underserved and underrepresented in our services. And I think for us, by engaging with communities, what we're doing is taking that participatory approach. They're the experts in terms of what might be happening in their communities, and we're not going into communities saying this is what we feel like you need to be doing. What we're trying to do is really understand at a community level what's happening in their communities around gambling related harms, and really understanding some of the barriers and how we can contribute to breaking down some of those barriers in local communities, but also equipping and empowering communities to be able to better identify and respond to those in their communities that may be experiencing gambling related harms. I think upskilling of the workforce is a really large part of what we're doing on the women's programme, to support an increased understanding and confidence to identify, support and signpost and refer individuals into services that are experiencing gambling related harms. So alongside upskilling the workforce, what we're trying to do is embed processes to support early identification. So once we've got an upskilled workforce, it's about making sure that the practices to support identification of gambling related harms is embedded in day-to-day practice that will support that early identification. So that's maybe thinking about how organisations can embed a starter question into their assessments and review processes. Some of the things that we've also done is we've co-designed advice, support and information and training by working with services and other organisations. So we design bespoke information based on local needs and the needs of services. So that could include, we've worked with a violence against women and girls coordinator in Tower Hamlets to look at their training that they're delivering to professionals and see how we can embed gambling related harms within specific sections of, say, for example, coercive control and the economic abuse sections. But we've also worked quite closely with Women's Aid, developing a case study and learner notes so that we can really bespoke our training where professionals can understand the relevance around gambling related harms and the work they're doing with victim survivors and perpetrators of domestic abuse. So we've got this case study that we've developed together alongside trainer notes to be able to upskill the domestic abuse sector, but the wider workforce as well, that could be working around safeguarding, but also domestic abuse champions as well. And then what we do is we can get into delivering workshops, delivering training and delivering presentations to public health, to social care, to safeguarding leads, and this is across the public and third sector. We also kind of sit at MARAC meetings to deliver awareness raising sessions. We work with mental health services. We've sat in the Safeguarding Adults National Network to raise awareness about our services and see how we can work with safeguarding leads that are working with adults around awareness raising and responding to individuals impacted by gambling related harms. And then I suppose in terms of that external work, it's so important, but it's also about what we're doing internally in GamCare as well. And that's absolutely crucial to embed that culture and that recognition of how we can better respond to individuals experiencing domestic abuse and gambling related harms. So through our work on the women's programme with various domestic abuse services, we've managed to gain training to raise awareness around domestic abuse with our frontline practitioners alongside the basic training, alongside the training that they receive around safeguarding. So upskilling the workforce in different areas and how to respond to, you know, individuals that are experiencing domestic abuse as victim perpetrators, but also recognising how we can respond to behaviours that we think might be abusive and respond to potential perpetrators of domestic abuse as well. We're also developing a staff policy with SafeLives, and that policy will combine training for line managers initially, and then we'll take a wider approach to delivering a webinar to the whole staff about the policy and really kind of ingrain it into the work that we're doing. And again, there's several tools and learning and reports out there. So any reports on domestic homicide reviews, we're taking a look at that and seeing how we can gather some learning to improve our approaches and our responses to anyone experiencing gambling related harm. So any opportunities to learn internally to be able to do that external work.
Great, thank you. It sounds really positive, and there are some real synergies there with your approach and ours here at SafeLives, particularly around that kind of whole system approach and embedding lived experience into everything you do. So yeah, it sounds great. So you mentioned domestic homicide reviews there, and we know that tragically in a recent domestic homicide review, gambling was identified as a factor. Can you tell us about the learning that came out of that review?
Yeah, absolutely. So just to give a little bit of information around it, I think through the work on the women's programme in 2020, GamCare's clinical director was invited to sit on a panel at a domestic homicide review. The review is now published, and it details in depth how the victim mentioned gambling to multiple professionals. The report also highlights the impacts of gambling related harms on the victims, on the victim herself, but also her children and wider family. And within the report, it talks about family members speaking about how they were aware of arguments relating to gambling and talking about sometimes the perpetrator being violent towards the family member. And a day before the victim's murder, a family heard there was an argument where the perpetrator had lost £200 of the victim's money on gambling. There were multiple agencies involved with the family, and the victim had disclosed to housing, GP and the police. And I suppose this report really draws out some rich learning for all organisations that are working with families. And some of the key recommendations, there are many recommendations that came through, I think, that will be really useful across the board. But also kind of really recognising the importance of multi-agency working and taking that multidisciplinary approach. One of the key recommendations that came through for us that we felt that we needed to kind of contribute to is to ensure that all professionals are able to identify and respond to gambling disclosures, including considering signposting or referral to gambling specialist support for both the person affected by gambling and family members. And I suppose here it's that recognition that we do work with those that are gambling, those that are affected by gambling, and we do have a young people service as well. So young people can access our young people service if they're gambling themselves, but also if they're affected by parental gambling or a carer's gambling. So it's that need to really work with organisations to upskill them so that they're able to identify and respond, taking that whole family approach.
Thanks, Marina. So thinking about what people who are watching today can do. So if a frontline practitioner came across gambling as an issue or a risk factor for someone they were supporting, what can they do to help in that respect?
So I think in terms of being better equipped to be able to identify and respond, I think is going to be really important. So it's about having the conversation. There's a lot of shame and stigma associated with gambling related harms. So I think it's really recognising that we need to take that non-judgmental approach to anyone that's experiencing gambling related harms. We need to just have that exploratory conversation about what is happening for families. We need to be asking the question. You know, we ask several questions with our service users and clients that are coming through our service. We need to be asking a question around gambling related harm. So the first thing that I would say is have that conversation, and we need to be taking that non-judgmental approach when it comes to disclosure. From a professional perspective, it's a case of arming yourself with all the information possible to be able to support that individual. So you don't need to be experts around gambling related harms, but you know, we're here to deliver that free training to upskill your workforce to be able to better identify and respond to gambling related harms. So it's arming yourself with all the information so that you can best support your clients and service users coming through your doors. It's having the information available. So we provide a huge amount of resources. If you go onto our website, you'll be able to take a look at all the leaflets that we provide around gambling related harms for those that are gamblers, but also those that are affected by someone else's gambling. Have those leaflets and information available, and you know, recognise how you might be able to support, but also signpost individuals into support, and how you might be able to refer individuals into support and treatment services. And I suppose it's that recognition that it's not everyone's going to want to go straight into treatment or access the National Gambling Helpline. I would say the National Gambling Helpline and the visibility of that needs to be across all services. But it's also recognising that individuals might just want to go away and have a look at our information, understand our services a bit better before they make a decision about what support they need, and that's also okay too. And it's kind of my ask would be to sign up to our free training, upskill yourselves, you know, as managers. Get your frontline practitioners upskilled to be able to respond, and we're able to bespoke our communications as well. If I know that if I'm walking into a service and I see a bit of information around gambling, I know that I might be able to speak to that person around gambling. So it's that visibility and knowing that I can, whatever, you know, service that I go into, that I'm able to get that that level of support. So it's a no wrong door approach to accessing our services is really important.
Brilliant. I mean, it sounds like there's a huge amount of support out there for professionals, so it's just about tapping into that and getting in touch with you guys. Thank you. So before we finish up today, is there anything else we haven't covered that you think it would be useful for people to know?
I don't think so. The only thing that I would say is that call for action. Please sign up to our training. We can support to embed processes of identification. You know, alongside the training, we have discussions about how we might be able to support your organisation to embed these practices in your day-to-day work. So get in touch, sign up to our training, and yeah. Absolutely, we need to be having those conversations, increase that visibility, break down some of that shame and stigma associated with gambling-related harms, and be better equipped to signpost and support individuals experiencing domestic abuse and gambling-related harms.
Brilliant. Thank you so much for your time, Marina. I know that's going to be so valuable for lots of people, so thank you.
Okay.